Hello everyone. Today we will discuss about very important high-yield topic for NEET PG exam about the pharmacology. So let us discuss in today's class about the hereditary angioneurotic edema. Hereditary angioneurotic edema, it is caused by deficiency of the C1 esterase inhibitor, and this leads to overactivation of the factor 12A, and that will ultimately lead to conversion of prekallikrein to kallikrein. This excess of the kallikrein will cause conversion of HMW kininogen into bradykinin, and this bradykinin will act on the B2 receptor, and that will result in increased vascular permeability, and that will result in hereditary angioneurotic edema. So this is the pathophysiology of the hereditary angioneurotic edema. Now let us understand which drugs you can give in the treatment of the hereditary angioneurotic edema. So first drug is Ruconest, which is a replacement therapy for C1 esterase inhibitor, and that will inhibit the conversion of the factor 12 to factor 12A. Another drug is Garadacimab, that will target factor 12A. So this is a monoclonal antibody which targets factor 12A. Now another drug is Donidalorsen. Remember those drugs which ends with the arsine, that will act on the mRNA. Donidalorsen, it attacks on the mRNA of the prekallikrein. So the target for Donidalorsen is a mRNA of prekallikrein. Now other drugs are sebetralstat, ecallantide, lenalidomide. These drug targets kallikrein. Sebetralstat, ecallantide and lenalidomide. Lenalidomide is a monoclonal antibody, and these all drug targets kallikrein. Another drug is icatibant. Icatibant is a antagonist of the B2 receptor. It acts on the bradykinin receptor. So B stands for bradykinin B2 receptor, and ANT, that stands for antagonist. So icatibant is a bradykinin receptor antagonist. ANT stands for antagonist and B stands for B2 receptor. So these are the drugs which you can use in the treatment of the hereditary angioneurotic edema. Now let us discuss one important MCQ. A patient with the recurrent hereditary angioneurotic edema is receiving lenalidomide. Its primary therapeutic target is bradykinin receptor, plasma kallikrein, factor 12A, C1 esterase. So remember, lenalidomide, it acts on the plasma kallikrein. So here the correct answer is plasma kallikrein. So lenalidomide primary therapeutic target is plasma kallikrein. Next MCQ. A 20-year-old woman develops recurrent episodes of facial swelling without urticaria. Which drug would provide replacement therapy for the underlying deficiency? Icatibant, Garadacimab, Constate alpha, Donidalorsen. Replacement therapy is provided by Constate alpha. So answer here is a Ruconest, or you can say Constate alpha. A patient experiences frequent attacks of hereditary angioedema despite of the standard treatment. A monoclonal antibody targeting factor 12A is planned for prophylaxis. Which drug is being prescribed? Lenalidomide, Garadacimab, ecallantide, icatibant. So factor 12A, that is being targeted by the drug, and the name of the drug is Garadacimab. So correct answer here is a Garadacimab. Next MCQ. A patient with the hereditary angioedema is prescribed oral plasma kallikrein inhibitor for on-demand treatment of acute attacks. Which drug is most likely prescribed? Sebetralstat, Garadacimab, icatibant, Constate alpha. Plasma kallikrein inhibitor, the drug is sebetralstat. So oral plasma kallikrein inhibitor is a sebetralstat. So this was about the hereditary angioneurotic edema, its pathophysiology, drug treatment, and the case-based MCQ, which can be asked in the NEET PG exam. If you like this video, then subscribe my channel and follow for more such pharmacology related videos. Thank you.